Hi, hello friends. Welcome to World Explorer India. Today, November 14, World Diabetes Day. Theme of the year is the nurse and diabetes. Hashtags #thank a nurse, #diabetes. Nurses make the difference for diabetes. The top 10 global causes of death in the year of 2016 according to global health estimates of World Health Organization includes ischemic heart disease, topping and followed by stroke, COPD, lower respiratory infections, Alzheimer's disease and dementias, trachea, bronchus and lung cancers, diabetes mellitus, road injury, diarrheal diseases and tuberculosis. World Diabetes Day, you can see there is 463 million adults currently living with diabetes according to IDF Diabetic Atlas 2019. International Diabetes Organization, Diabetes Federation and World Health Organization combinedly and United States Awareness Day on November 14 we are celebrating World Diabetes Day, which is being celebrated all over the world by local campaigns, activities, screenings and meetings. The theme of the year is the nurse and diabetes. World Diabetes Day started in 1991 by IDF, that is International Diabetic Federation. United Nations Resolution 61 by 225 of 2006. 14 November, birthday of Sir Frederick Banting, who co-discovered insulin along with the Charles Best in 1922. The logo is blue circle. It is a global symbol for diabetes mellitus awareness. Year of 2020, nurses can make all the difference for those affected by the diabetes. Now let's see what is nursing. 59% of health professionals are nursing. Globally, 27.9 million nurses. Global shortage of 5.9 million nurses. 8% growth by every year will overcome shortfalls by year of 2030. The 90% of healthcare workers are female nurses. To achieve SDG, we need to invest in health workforce, eradicate poverty, ensure inclusive and equitable education and gender equality. Nurses and diabetes. Nurses are the first to recognize early diagnosis, self-management training, tackle factors for type 2 diabetes mellitus. So, if you are the person who is got benefited by the nursing care, nominate a nurse with the hashtag nominate a nurse. World Diabetes Day. And nurses make the difference. These are the hashtags for the year. Diabetes facts and figures. 463 million adults with diabetes mellitus in the year of 2019 and expected is 578 million by the year of 2030. 3 in 4 from low middle income countries and the middle income countries. 1 in 6 live births affected by the hyperglycemia. 2/3 live in the urban areas. 1 in 5 above 65 years of the old. 4.2 million deaths by diabetes mellitus in the year of 2019. $760 billion expenditure in the year of 2019, accounting to 10% of the global expenditure for diabetes. Diabetes is a serious chronic disease. Pancreas is not able to produce the insulin. Insulin is a hormone which regulates the blood sugar, because of which we can see hyperglycemia, that is called as uncontrolled diabetes. There are types of diabetes, type 1, type 2 and GDM. Type 1 diabetes mellitus is an autoimmune reaction where body's immune system attacks beta cells of the pancreas and very little or no insulin is produced. Type 2 diabetes mellitus is characterized by hyperglycemia because of the insulin resistance, and GDM is gestational diabetes mellitus which occurs during the pregnancy. Type 2 diabetes mellitus accounts for 90% of the diabetic cases worldwide. Type 1 diabetes mellitus is usually seen in children. GDM is seen in pregnancy. Type 1 diabetes mellitus is insulin dependent or juvenile or childhood onset diabetes mellitus. Here we can see there is a deficient in the insulin production. So because of deficiency in the insulin production, they need insulin to survive. The symptoms of type 1 diabetes mellitus are polyuria, polydipsia and polyphagia. Polyuria is frequent urination, polydipsia is excessive thirst and polyphagia is constant hunger. Apart from this, we can see the blurred vision, bedwetting and lack of energy, sudden weight loss. So these are the Characteristic symptoms of the type 1 diabetes mellitus. Type 2 diabetes mellitus is also called as non-insulin dependent diabetes mellitus or adult onset diabetes mellitus. It's related to excessive body weight and the physical inactivity. Symptoms are same as that of type 1 diabetes mellitus. The only difference is type 1 diabetes mellitus, they need insulin for survival, but type 2 diabetes mellitus can even be managed with the help of medications. Gestational diabetes mellitus, this occurs during the pregnancy. This is having increased risk of complications to the baby and also to the mother. The prenatal screening is very much essential for everyone to identify whether there is gestational diabetes mellitus or not. The symptoms of impaired glucose tolerance or impaired fasting glycemia, risk of progressing to type 2 diabetes mellitus. Why there is increasing rates of diabetes? Diabetes is increasing nowadays because of obesity, sedentary lifestyle, unhealthy diet, physical inactivity and high calorie intakes and processed foods. The processed foods which are having, the packaged foods are having excessive added sugars, the carbonated beverages are having the added sugars. So these are the things which is leading to obesity, and apart from this there is sedentary lifestyle which is again causing the diabetes mellitus. Insulin is produced by the pancreas. Glucose is converted to energy. If there is no insulin, we see hyperglycemia. Hyperglycemia is increased blood glucose level. If there is insulin deficit, again it may lead to cardiovascular diseases, neuropathy, nephropathy, retinopathy, visual loss and even blindness. Complications can be prevented or delayed. These are the top countries where number of people with the diabetes. You can see China is the number 1 country of diabetes, followed by India, USA, Pakistan, Brazil, Mexico, Indonesia, Germany, Egypt and Bangladesh. Diabetes complications and comorbidities include diabetes ketoacidosis. This is the most common cause of ICU admissions for the patients with diabetes. Apart from this, we can see neurological consequences such as diabetic neuropathy. Hypoglycemia is sudden fall of blood sugar because of insulin the patient are taking. Seizure and coma. Dead in bed syndrome, because the patients are not able to identify the symptoms of hypoglycemia and they go dead in bed syndrome. Hyperglycemic hyperosmolar state and infections. So these are the complications of diabetes. All the diabetic patients are at having increased cardiovascular risk, 2 to 3-fold increased risk of heart attack and stroke because of diabetes. Hypertension, coronary heart disease, ischemic heart diseases, hemorrhagic stroke is very common in the diabetic patients. And diabetic retinopathy, because of damage to the small blood vessels of retina, so there is a chance of patients with diabetes to get diabetic retinopathy. Apart from this, diabetic macular edema, cataract, glaucoma, double vision and inability to focus, these are the complications of diabetes mellitus. And diabetes affects even the kidney. It is leading cause of kidney failure. So we can see the complications such as CKD, ESRD, diabetes, hypertension, albuminuria. So these are all the common complications. They even need renal replacement therapy like hemodialysis, and anemia is most common complication. Diabetic foot, if there is no proper care being taken for the foot, the patients are going to get the diabetic foot, and because of which there may be infection and even they may need to go for lower limb amputation. Nerve damage to foot ulcer to infection, and again it lead to the limb amputation. Pregnancy, gestational diabetes mellitus, and again it will lead to the adverse perinatal outcomes. Oral health complications related to diabetes are gingivitis, periodontitis, dental caries, periimplantitis, thrush or candidiasis, hyposalivation, taste alterations and glossodynia. Glossodynia is burning mouth syndrome. So diabetes mellitus is a burden for each and every patient because it is the cause for worry, anxiety, discomfort, loss of independence, premature mortality and economic effects of the persons. the only thing we can do is prevention, that is primary prevention by change of lifestyle, decreased use of the processed foods, exercise or promotion of physical activity, routine or annual health checkup, eye care, foot care and dental care, checks on smoking, alcoholism, diet, exercise, medication adherence and insulin techniques. Maintain healthy body weight according to the body mass index. Be physically active, at least 30 minutes of regular moderate activity, healthy diet, avoid sugar and saturated fats and avoid the tobacco use. Nurses make the difference because nurses can be the persons who initially identify the diabetes, and diabetes nursing specialty is coming nowadays. Professional development of diabetes nurses is very much essential. Diabetes prevention programs, primary and community healthcare systems need to support the nurses. Diagnosis of diabetes is done by blood sugar testing. Treatment, diet management, physical activity, maintain blood sugar levels with medications like metformin, tobacco use cessation, insulin, blood pressure control, foot care, screening for retinopathy, goal for the prevention of complications. Insulin, there are 3 different types of insulin are available: long acting insulin, intermediate acting insulin and also the rapid acting insulin. Based on the dietitian suggestion and consultation, you have to take the insulin if needed. Insulin has side effects such as hypoglycemia and lipodystrophy. Lipodystrophy is losing of adipose tissue at the site of injection, because of which there is a changes in the body image. So to avoid this complication, you have to rotate the sites of insulin. Hypoglycemia, this is a complication. These are the symptoms: headache, palpitation, hunger, nausea, sweating, anxiety, cold clammy hands and unconsciousness. So every person should be able to identify the symptoms of hypoglycemia, and they should have to keep some of the sugar substitute along with them if they should take the sugar, or they maybe need infusion of dextrose D25% immediately if they are in ICU. Living with diabetes is a lifelong journey. They need a constant support and constant education and prevention of complications by correct education. So this is the bibliography: International Diabetes Federation and World Health Organization. So these are the bibliography from which I have taken the information. If you like this video, subscribe, comment and share. Thank you.